Left of the box. What are like some of the differences between Canada and the United States that a lot of Canadians we understand is a reality? And one of the major reasons why Canadians don't want to become part of the United States is healthcare. Yes. It'd be nice if Canadians paid more attention to what was happening to our healthcare up here. But generally speaking, the vast majority of Canadians appreciate our system far, far, far more than Americans appreciate yours. So let's see what some of those differences are. Kyle Clancy tweeted this out. Elon Musk, Trump, and Republicans said, "Fuck you" to 9/11 first responder heroes.
We're calling on the administration that's coming in. We're calling on the senators and Congress people that have made their promises to honor what everyone has said, to never forget.
New York City Fire Department unions are calling for the restoration of funding to the James Zadroga 9/11 Health and Compensation Act after it was left out of Congress's funding on Friday. The act guarantees medical treatment for first responders, firefighters, and survivors who helped with the recovery efforts following the World Trade Center attack. It also provides financial compensation for those who suffered injuries, illnesses, or death as a result.
We're calling on the...
So you have a bunch of firefighters who responded to 9/11 who are fighting just to have health care. Like, that is so sad. And it's horrific for the people that suffered that tragedy and then got all the toxic chemicals and stuff into their bodies, and they need that health care. So we have a whole bunch of people, like, if you would think any Americans would get health care, it would be Americans like them. But no, even they have to fight to have health care. This is what our healthcare fights currently look like. This is from Dr. Jill Andrew. She's an NDP MPP. This week I asked the government to back my motion eliminating hospital parking fees for patients, visitors, and staff. It's outrageous. As the government spends public money on foreign luxury spa, Ontarians have to pay for parking to visit a sick loved one.
Across Ontario, people are paying enormous parking fees at hospitals. In the GTA alone, a monthly parking pass is about $400. That's a lot of money, especially for our overworked and underpaid healthcare workers. Earlier this week, I tabled a motion calling on this.
So that parking pass is expensive and we shouldn't have to pay for it. Like, I'm all for having free parking at hospitals for patients and visitors. And I think that should be a thing because a lot of people can't afford to go visit their loved ones with these really high parking fees. And this, like, I'm not being sarcastic when I say this, like, we need to be fighting to improve our healthcare in Canada, whereas too many Canadians have our eyes closed and we're losing a lot of what we have. Like, this should have actually been addressed years ago, but instead of progressing with being better in healthcare and including more things, we're actually starting to turn backwards.
This government to eliminate hospital parking fees for healthcare workers, hospital staff, patients, and their families, and adequately fund our public hospitals. Patients should be able to bank on this government to properly fund our public hospitals and not revenue from a parking spot for the hospital care and services they need. My question is to the Premier. Will this government provide necessary funding to eliminate hospital parking fees today so healthcare workers, patients, and families can have one less financial burden at the hospital tomorrow? Thank you.
Parliamentary Assistant Member for Essex.
Thank you, Mr. Speaker. The Hospital Parking Directive is a directive that exists in the province of Ontario, and the purpose of the Ontario Hospital Parking Directive is to keep the financial costs down on parking fees for patients and the visitors at hospitals. The directive was created to reduce the barriers to accessing health care. Mr. Speaker, under the Ontario Hospital Parking Directive, there is a cap placed on any increases for parking fees in parking spaces associated with hospitals. In addition to that, there are also special rates created for a 10-day pass or a 30-day pass. This is all in keeping with our policy to help keep the financial burden of parking down for patients and for people visiting patients at hospitals in Ontario. Thank you, Mr. Speaker.
Thank you. And the supplementary question.
Thank you, Speaker. I wonder if the Premier or any MPPs pay for parking here at Queen's Park. Anyhow, back to the Premier. CTV News recently reported on a Toronto woman who paid nearly $2,000 in parking fees to visit her mother.
So that's why a lot of Canadians don't want to be American. Americans fighting just to have health care, Canadians free parking at the hospital.